Introducing the FemLab Vaginitis Test Kit. Vaginitis is a condition involving infection and inflammation of vaginal tissues and results in millions of visits by women and girls of all ages to their gynecologists each year. Causes include organisms such as bacteria, yeast or viruses, or parasites. The most common types of vaginitis are bacterial vaginitis, chlamydia, trichomonas, and candida yeast infections. These common forms of vaginitis can be treated effectively with prescription or over-the-counter medication if correctly diagnosed. If left untreated, misdiagnosed, or incorrectly treated, vaginitis can produce serious consequences, such as sterility or miscarriage, and can be a precursor to cancer. The FemLab test kit can accurately diagnose common types of vaginitis within a few minutes. The FemLab test kit is intended for use by a medical professional or may be used at home with medical supervision. Samples of vaginal fluids are taken on sterile swabs and applied to test zones on the test kit cassette. The test kit zones change color to indicate results. Using the FemLab test kit. The FemLab test kit includes vaginal fluid specimen container with buffer solution, tri-pack sterile swab, instructions for use, test tray. Prepare a clean work area and open the package. Read the package insert completely. Wash hands thoroughly and observe sterile technique while performing the test. Remove the test cassette tray from the foil pouch. Write the patient's name in the space provided on the FemLab test tray. To prepare for taking samples, thoroughly swab the inner and outer labia of the patient with a sterile wipe. Open the sterile tri-pack of sample collection swabs. Gently open the vaginal opening and insert the swabs about 2 to 3 inches into the vagina. Do not insert near the cervix for accurate pH results. After 2 minutes, remove the swabs from the vagina. Rub one swab saturated with fluid sample onto zone 1, the pH zone of the test tray. After 3 minutes, read the pH color and note the result on the test cassette tray. While waiting for the pH result on Zone 1, rub the second swab 6 or 7 times onto Zone 2A. Then immediately rub the same swab on Zone 2B several times. Wait 1 to 5 minutes. If the swab itself becomes peach or pink within 1 minute, it is a positive reading for Gardnerella. Record the Gardnerella result on the test cassette. After you have placed the first 2 swabs on Zone 1 and Zone 2, open the vaginal fluid specimen container with buffer solution and swirl the third swab vigorously for 15 seconds in the buffer in the container. Then press as much liquid as possible from the swab. Insert the dropper tip securely into the specimen container opening, and then screw the cap over the dropper tip onto the specimen container. Shake vigorously up and down 10 times. Remove the cap and hold the container above each of test zones 3 through 6, carefully squeezing 1 drop onto each. Wait about 2 minutes and then circle the squares for zones 3 through 6 that most closely match the test zone colors. Test results. Zone 1, the pH test zone, will show a light blue-green color if the pH is above 4.7. This may indicate a bacterial infection and will also be present with most cases of trichomonal vaginitis if leukocytes, zone 6, are also present. No color change indicates a pH below 4.7, which is normal for the vagina. This indicates the absence or very low level of bacterial infection or trichomoniasis. Zone 2, the Gardnerella test zone, will show a peach-pink color in Zone 2B and on the test swab within 5 minutes if a Gardnerella bacterial infection is present. Zone 3, the nitrite test zone, will show a pink color if a yeast infection is present. Zone 4, the blood test zone, will turn from yellow to dark green or blue if red blood cells are present in the buffer-diluted sample. A positive result generally indicates the presence of chlamydia bacteria if leukocytes in Zone 6 are also present, but may also be positive with other bacterial or yeast infections. Menstrual blood in the sample may result in a false positive test. Zone 5, the protein test zone, will show a blue color if the buffer-diluted sample contains protein in excess of normal values. A positive result is associated with serious occurrences of bacterial, yeast, chlamydia, or trichomonal infections. A negative protein zone result is associated with the absence or lower levels of these infectious organisms. Zone 6, the leukocytes test zone, will turn a light purple color if white blood cells are present in the sample. A positive result indicates the presence of trichomonas parasites or chlamydia infection. If both leukocyte and blood tests are positive, zones 4 and 6, it is likely that chlamydia is present. If both leukocyte and pH tests are positive, zones 1 and 6, it is likely that trichomonas is present. If any form of vaginitis is indicated, a medical professional should be consulted. FemLab is not to be used for self-diagnosis or self-treatment. Conclusion: the FemLab Vaginitis Home and Professional Test Kit combines sophisticated proprietary testing methods in an inexpensive, easy-to-use package. The diagnostic results are immediately readable, and women with symptoms of vaginitis will find this easy-to-use method of resolving this very private matter to be a huge improvement in their personal health care. Please contact your doctor to find out more about this revolutionary new FDA-approved product.